Hi there, it's Jacek Kasberuk from 360 Therapy. I would like to share with you three tips about your diaphragm. A really important muscle. As you may know, it separates or connects our chest with abdominal cavity. Its health and proper function is super important for our health, for both our internal organ health, but also for our breathing, for our circulation, for hormones, for our lymph distribution. So, for example, swelling in our legs can be sometimes caused by tightness in the diaphragm, hiatal hernia, anxiety and stress, to just name a few. So, really good one to look after. How do we do that? Those three techniques and tips are just the beginning of it. Of course, we could do a lot more, but this will give you an idea. This will give you also some tools, very useful tools to daily help with tightness of your diaphragm, with stress and all sorts. So the first thing that we will do today will be release of the diaphragm, manual release of the diaphragm. So if you follow from the center of your body, sort of like the bottom of your sternum, there's a contour of your ribs coming down to the side. So diaphragm basically starts there and then comes up and then to the back, connecting the ribs to the spine, to the level of lumbar vertebra L2 and L3. So it's kind of like an arch structure, muscular structure. So what we do now, we want it strong, but we don't want it in the spasm, we don't want it tense. So we want it to be able to come down and allow the air into the lungs, and also to come up to allow the air out. This type of breathing is particularly good for relaxation, for nourishment, for slowing down, for more grounding, opposite to apical breathing, which is breathing with tips of our lungs, which is good for survival. It's good to helps us to escape from the tiger or from the lion on the desert, or helps us to survive in a situation of danger, but it's not very good to sustain our energy and our health. It's actually causing often the opposite, exhaustion and tiredness. So what we want to really activate that muscle and allow it to relax and to come down as much as we can. So first, what we will do, we are going to release, as I said. We are in the center, in the lower point of our sternum and the line of our ribs. And now with our fingers, we're going to come around the edge of the ribs with our fingers pointing up towards our head. And we try to keep contact of our parts of our fingers with the inside of our ribs, like that. If we're doing that in a sitting position or lying down on our back, we can do it in our chair or in the sofa. It's also good when we're sitting down to slightly slouch like that. And like that we will start not in the center line, because here we have a very strong ligament running down towards the pubic bone, but we want to be a little bit off that center line. So we start next to it and we coming up with our fingers around the edge and pointing towards the head. And we stay here for a moment, trying to feel the release of our diaphragm. And sometimes it may take a while until we feel any release or any difference. Sometimes it will take days until we feel something, but it will be substantial, it will definitely be worth it. So like that, we also treating here our organs which are related to the diaphragm. They have here gliding surfaces. So on your right side you will have the liver, on your left side you will have the stomach, and also ascending and descending colon. Also we will influence here gallbladder. So lots of good work can be done like that. So basically what we do, we go and scan first, trying to find the places of tension, places where we are not able to put our hands, our fingers really much between the organs and the ribs, and we cannot actually move them much up as well. So identifying those places, or just literally we can start as well treating like that immediately. So we're kind of leaning back into our sofa, really relaxing, making sure that we not engage our abdominal musculature, because like that we're gonna push our fingers up straight away. So we want it all nicely relaxed, and we just follow the contour of the ribs, and each place we stay a little bit, so we are around the edge and up. And like that we imagine that we are, with the warmth and the sustained pressure of our fingers, we are melting some structure. We can think about melting an ice, melting a butter, or chocolate. Chocolate is the best, probably. Of course, only 70% cacao, organic chocolate is a real chocolate. So, we're melting a chocolate, finding in each place. We may take 10 seconds, we may take a minute, maybe even longer. And then sometimes we will feel some gurgling sound, or hear it even, coming from either left or right. That's perfectly fine. We are releasing the tension in our stomach, or in large intestine, or gallbladder is draining. Excellent work. If we don't, it's also fine. And if we find a particular point which is really, really stubborn, we can come back to it with 2 hands on one side, or 1 hand on one side, and do exactly the same. Comb around the edge, fingers towards the head, and stay there. And feel the wait for relaxation. Okay, come up. Now the other is a stretch. So we're gonna be holding the fingers of our one hand with the fingers of the other hand. I'm holding the left hand, the right. So stretching up towards the ceiling and to the side. So all this side is stretching here, and I'm staying here maybe for 1 or 2 breaths, directing breath to this side, to this arch, to this sort of side of the rib cage, and back. And again, I can change my hands, up and to the side. 1 or 2 breaths, and back. Okay, you can do like that 2 or 3 times on each side. That will be really enough. And then the last thing is a breathing exercise, is to learn how to control our diaphragm. So as I mentioned, there are 2 ways of breathing. One way is to breathe through the tips of your lungs in the survival mode, and the other one is the one for relaxation. This is the breathing that we also do when we meditate, for example. So again, sitting comfortably or lying down on your bed before sleep. And here a little note that you can also do the manual release of the diaphragm in lying down on your back. The same way, exactly, coming up and down, finding the tender spot, staying there and releasing. So now we're breathing. So in both cases we keep our knees bent because we want as little tension on the abdomen as possible. You can also use a pillow to give again a little bit more support. Let me just get the pillow. So here even more relaxation on the abdominal wall. So now with my hands on my belly, I will focus on the abdominal or diaphragm breathing, which basically looks like this, that when we're breathing in, our abdomen comes up. When we breathe out, our abdomen comes down. If you find it difficult to keep your legs, your knees bent, you can also extend it, there's no problem. Just that you feel really, really relaxed and you can focus on what's going to be happening now. So you're breathing in, belly up, belly down. Breathe through your belly, through your nose, you can breathe through your mouth. Doesn't matter. For some of you it will be something new. So in the beginning it will be difficult to get in the rhythm. So we try to make sure you can put also one hand on the chest, that you know that you're breathing with the belly. There's no that chest is expanding, and then the abdomen comes up and down. And we count to 10. In the beginning it will be an effort, and it's fine. So with the effort, we breathe in, belly up, belly down. We can also press on the abdomen down to make sure that we breathe all the air out, and that would be easier to adjust with our belly. And down. If you want, you can also put heavy book here. Encyclopedia, very useful application of it. Breathing in and down, or yellow pages, in and down. Count to 10, take a little break, and again 10 times. Do it in the morning and do it in the evening. You can do 2 or 3 rounds of 10 breaths twice a day, with maybe just 1 round for the start, and the morning 1 in the evening before sleep. It's also very, very good exercise to really ground yourself and to relax. So important to do it in the evening, maybe with a bit more effort in the day. Again, the same thing can be done in sitting, leaning back comfortably onto the chair. Breathe in, out, and out. Breathing out, breathing in, and so the front belly expands. And out. It's not that we're allowing air to the abdomen, it's more like because we're activating the diaphragm, our diaphragm dome comes down and pushes organs a little bit down and to the front. This is a sign that actually diaphragm is activated. In some cases, in some patients, I see that there's a tendency not to activate the diaphragm, and this is a very important thing to actually help yourself with also, as I said, all sorts of issues, with anxiety, nervousness, with circulation problem, with breathing problems, organ problems, but even pelvic floor issues. Very, very, very effective way to help here. So do it first with a bit of an effort, but later what we really want is a habit. We want to create a habit, a good one, a one when we breathe with our abdomen, especially that most of the day we don't have to survive on the desert, we don't have to fight the enemy. We really want to relax and allow more air, allow more massage, allow more blood into the digestive system, because that's where our immunity is happening. This is where our hormones are being produced. I mean, I'm talking about abdomen. It's a very, very important part of our body. So try that, as I said, few rounds in the morning, few rounds in the evening, and then maybe sometimes during the day focus also, what am I doing? How am I sitting? Where's my breath? Or am I grounded? Am I centered? Maybe in your work, take a little break, sit your back relatively straight, or slouch, slightly slouching or leaning back in the chair, really, really relaxed. Breathe to your abdomen. Also in your meditation, check how you're sitting, whether you are supported on your sitting bones or not. This is actually very important in the meditation, to sit straight, sitting straight, and see what's happening with your diaphragm. Am I actually relaxing my abdomen? Like that, this will help us to really center and ground ourselves, which is one of the benefits, or 2 benefits of the meditation. So, hope this is helpful. In case you would like to hear more or to know more about your diaphragm, or to help you with your diaphragm and release of this muscle, get in touch with ANA therapy in Gravesend, and you can book your session there with myself or one of my colleagues who also work with the internal organs. So, hope you're well and hope you find it useful. Take care.